up to 20% of pregnant women and those who have recently given birth experience postpartum depression, which is the most common complication following childbirth, affecting 1 in every 7 women. Here to tell us more is Naomi Savoie-Miller from Pine Rest Mother and Baby Program. Thank you so much for coming. This is such an important topic that I don't think people, stop to really think about. It just kind of sneaks up on you. So I was reading, what is the difference between baby blues for new moms and then postpartum depression? Because there's a difference, right?
That's a great question. So the baby blues is very common. It's normal for a mom to feel emotional after the birth of a baby, maybe even to feel a little overwhelmed within those first 2 weeks, but her core sense of self should be intact. So if she's really just feeling like she's lost who she is, or if the symptoms do not resolve within 2 weeks, then that's a pretty clear indication that she should seek evaluation for possible further treatment.
And how does this happen? I feel, I've heard it. My sisters who, have been through and have children, they have had, gone through it as well. So how does that happen? How do you like, oh, this is happening right now?
Unfortunately, we don't have a formula, so we can't tell you like this and this.
No, it's okay.
We don't have that, but we do know risk factors. So the biggest risk factor for any perinatal mood and anxiety disorder is a personal history of mental health symptoms. So if you've had anxiety or depression in the past, that's a big risk factor for developing those symptoms again in pregnancy or postpartum, but not always. Other risk factors include a perfectionistic personality, which is really important for people to know because perfectionists look really good on the outside. Right? They look put together, so we might think she's okay, she looks good, but inside she might be silently suffering. Other risk factors would be family history of any mental health, any recent big changes, relationship stressors, a move, any history of like infertility, stillbirth, or miscarriage would be another potential risk factor.
And so some other things, so prenatal mood and anxiety disorder. And so how is that different than postpartum depression?
Sure. So postpartum depression is a term that we're all pretty familiar with, I think. We kind of use it interchangeably. So we have this term now called perinatal mood and anxiety disorders to encompass all of the mental health symptoms that a mom can have during pregnancy and postpartum. So anything you can be diagnosed with outside of pregnancy and postpartum, you can have during pregnancy and postpartum. So it would include depression, anxiety, OCD, post-traumatic stress disorder, psychosis, bipolar, any of those things can happen. And so that's just the umbrella term that we use to include all of them.
And so how do you know, what are some main, warning signs and symptoms that, you may be experiencing?
Sure. So first, I just want to let any moms know that might be watching this, if you feel in your gut like something's wrong, most likely something is wrong, and please don't be afraid to seek out help. But other risk or other warning signs would be any change in mood. So we think of sadness a lot, I think, with postpartum depression, but a lot of our moms don't actually feel sad, they feel mad. Irritability is a huge warning sign. Anything that used to bring you joy and doesn't bring you joy anymore would be a warning sign. Any changes in appetite or sleep.
And so in Pine Rest Mother and Baby Program, you guys also offer help to, for women that are going through this as well. So what kind of stuff do you guys do there too?
So we offer daily intensive treatment for women who are pregnant up to 3 years postpartum. So we have daily groups for them, including group therapy, activity therapy. We want to teach them coping skills, self-care activities, and how to build up their support systems.
And if you want to learn more, you can visit our website, 13onyourside.com. And thank you so much for watching, and I hope you have a wonderful day.